Assalamu alaikum viewers, I am Dr. Sadaf welcoming you again in OUC. How are you all? I am fine and hope that you would also be sailing in the same boat. Rather, I wish and pray that you would receive this lecture in the best state of your physical and mental health. So let's start with today's topic. As you know, we were studying endocrinology and the next hormone, especially anterior pituitary gland hormones. So next hormone in this category is thyroid stimulating hormone. Let's have a look what is thyroid stimulating hormone. Like all other hormones secreted from the pituitary gland, this hormone is also being controlled by one of the hormones from hypothalamus. So as you can see, hypothalamus is releasing thyroid releasing hormone or thyrotrophin releasing hormone, which acts on pituitary gland. And if this thyroid releasing hormone, it acts on pituitary gland, in response to it, thyroid stimulating hormone is being secreted from anterior pituitary. Now once this thyroid stimulating hormone it comes in blood, it immediately acts on thyroid gland. What is thyroid gland? This is actually largest of all the endocrine glands, situated in front of neck, especially in front of larynx and trachea, covering the area of last 3 cervical vertebrae and first thoracic vertebra. This is actually a butterfly shaped gland having 2 lobes, and in between there is a narrow isthmus joining the 2 lobes. So thyroid gland, in response to thyroid stimulating hormone, it actually secretes 3 of the hormones: T3, T4 and calcitonin. So calcitonin, actually its secretion is independent of TSH or thyroid stimulating hormone. Its secretion is more or less controlled by blood calcium level. So more specifically, thyroid stimulating hormone controls the secretion of T3, Tri-iodothyronine and T4, tetraiodothyronine from the thyroid gland. So these two, T3 and T4, as I have mentioned the name of iodine, so it is obvious that iodine, a mineral, is needed for the synthesis of thyroid hormones. And if someone is lacking in iodine, their diet is not containing enough or sufficient quantities of iodine, then definitely their synthesis of thyroid hormones is going to suffer. So T3, T4, basically these are we can say more specifically thyroid gland hormones are also known as metabolism controlling hormones. These 2 hormones control the metabolism of body. Now another thing which you can see here, that T3, T4, they are actually having a negative control on TSH. It means whenever secretion of T3 and T4 crosses a normal level, usually a baseline level, whenever they become more than what is required by the body, they actually inhibit the secretion of TSH or thyroid stimulating hormone from the pituitary. In this way, this is a mechanism which is known as auto control mechanism or homeostasis. So a negative feedback mechanism, and this negative and positive feedback, they are actually a very important part of homeostasis, or I have already discussed homeostasis is maintaining of internal environment in an organism regardless of changes in the external environment. This is known as homeostasis. So one of the part of homeostasis is negative feedback mechanism, in which whenever a hormone it crosses a normal limit which is actually set by body. So whenever it crosses it, it automatically switches off or automatically decreases its triggering factors. So in this way, it automatically controls its own secretions. Okay, so hypothalamus releases thyrotrophin releasing hormone. Pituitary in its response secretes thyroid stimulating hormone, which acts on thyroid gland situated in front of the neck. And thyroid gland in its response secretes 2 main hormones, T3 and T4. Okay, and there is also a third hormone, calcitonin, secreted from thyroid gland. Okay, so now there are 2 different conditions or situations which result from abnormalities in the secretion of T3 and T4. As I have already mentioned, T3 and T4 require iodine. So one of the main reason in the malfunction of these hormones is actually iodine deficiency, especially in hypothyroidism. One of the main causes inadequate supply of iodine in diet, which may disturb synthesis of thyroid hormone. Although thyroid gland and pituitary and hypothalamus may be perfectly normal, all they need is a healthy supply of iodine. That's why you have noticed that nowadays, to minimize this deficiency of iodine in diet, there are many fortified, especially fortified salt, iodine fortified salt is available, and which you can use table salt instead of chlorine. In table salt, instead of chloride, iodide is present, sodium iodide. So it may minimize the chances of this deficiency of iodine. Okay, so there are two situations resulting from thyroid hormones discrepancies. Number one is hyperthyroidism, as you can see, and number two is hypothyroidism. What is hyperthyroidism? Hyperthyroidism is actually increase in the secretion of thyroid hormones, first of all. And as thyroid hormones, I have already mentioned, they control metabolism of body. So as these hormones are increased, metabolism of body is increased. What is metabolism? A set of chemical reactions as a result of which energy is released. Food is being broken down, energy is released. When these set of chemical reactions increase, they occur at increased level. It means everything a person is eating is immediately broken down. Especially its part is, it has two things. Metabolism includes two different type of reactions: anabolism and catabolism. Anabolism actually means building new molecules, and catabolism is breaking down of different molecules, so as a result of which energy is released. Whenever thyroid hormones increase, they actually increase the part of which part of metabolism? Catabolism. So as catabolism is increased, increase energy production in the body, and there is a situation resulting from it, a disease which is known as Graves' disease. One of its example is Graves' disease. There are many other of hyperthyroidism actually. So thyroid hormones actually, they are TSH specifically, its secretion, and TRH and TSH secretions is actually controlled just like growth hormone I have mentioned. It is controlled by sleep, so hypoglycemia, exercise and stress. These are the four things which stimulate the release of thyrotrophin releasing hormone from hypothalamus, and ultimately the release of thyroid stimulating hormone and thyroid glands. So as we have studied in growth hormone too, that specific hypoglycemia or decrease in blood glucose levels, especially during sleep at night, a little bit of stress and exercise, it stimulates growth hormone, which increases growth of body. Similar is the case with thyroid hormones. All of these things, they also increase thyroid hormone secretions, so it means they increase metabolism of body, which is good. So hypothyroidism, what is hypothyroidism? Whenever thyroid hormones, they are less than normal baseline level, they actually result in a disease or a situation which is known as hypothyroidism, in which the body metabolism is decreased less than normal. And if this decreased metabolism or thyroid hormones, they decrease before birth, especially in the intrauterine life of an organism, of an individual especially. So a resulting situation is keratonism. And keratonism, mostly the babies which suffer from keratonism, they actually during the intrauterine life. Why? Because their mothers do not take enough amount of iodine during that period, so they suffer from this situation, keratonism. Hypothyroidism may occur later on in life to anyone. So what are the things which are going to be affected when this metabolism either increases or decreases? Let's have a look. There are many, actually these are signs which we can see that whenever there is increase in metabolism or decrease in metabolism, what happens? Metabolism actually, it controls energy production in body. So if metabolism is increased, it means increased energy is being produced in body, and this increased energy may increase all of these factors which I have mentioned below. Heartbeat increases, energy, whenever energy production is increased. So those persons suffering from hyperthyroidism, they are going to have increased heartbeat, increase in energy production obviously. This ultimately will affect sweating. They will be sweating like anything, increased sweat production due to increased hyperthyroidism. Then their body temperature is going to be rise greater than normal. Why? because of again any increased energy production. And to manifest increased energy production, one of the feature is actually shivering of hands. They may suffer from fine tremors, which we call as, and all of these things, they are reversed in hypothyroidism. Any patient suffering from hypothyroidism due to any cause, they may have decreased heartbeat, decreased respiratory rate, sweating although is diminished or totally they do not have any sweating. Their skin body temperature is less than normal, cold extremities they are having, their skin is more dry, sebaceous gland, sweat gland production, all is decreased, and they are much more drowsy, not active. So whenever metabolism is increased, a person becomes more alert. Whatever he or she eats is immediately broken down, energy is released, so nothing is to be stored in their body. As a result, what happens? They are not going to gain weight. Such persons, they have much more appetite, they eat everything, but they do not gain much weight. Hyperthyroidism. While opposite happens in hypothyroidism, what happens? They usually put on weight with even mild, they do not have good appetite, and they do not eat much, but they put on weight. They are always drowsy, they are not active, their skin is cold, lack sweating, skin problems, low heart rate, not much sweating, and they feel all the time lethargic. So these are in general features of hypothyroidism. Why? Because thyroid hormone is actually controlling metabolism of the body. Now, if we discuss calcitonin, calcitonin is a hormone also secreted from some of the cells of thyroid gland, C cells usually. The calcitonin, its primary function is to control calcium levels in the body. So its secretion is more or less regulated directly from the blood calcium level. If blood calcium increases, it ultimately increases the secretion of calcitonin. So what happens? Calcitonin will ultimately will start depositing this extra blood calcium into bones. So bones become stronger. At the same time, it inhibits calcium reabsorption from kidney nephrons. So both of these actions, they ultimately will decrease blood calcium, but they will increase bone calcium. So calcitonin is a good hormone in this way if its levels are controlled, remain balanced in body. So it makes bones stronger. So that's all about thyroid, stimulating hormone secreted from the pituitary. Its secretion is actually, if we recapitulate quickly, so its secretion is controlled by thyrotrophin releasing hormone from hypothalamus, and ultimately TSH acts on thyroid gland. It releases T3 and T4. Whenever T3 and T4 its levels are increased above normal, they due to negative feedback inhibit TSH. Now T3, T4, what are their functions? To control metabolism and energy production. Especially they also control the development of nervous system. So initial years of age, the development of nervous system is very important. That's why the person suffering from less secretions of hypothyroid hormone during intrauterine life, that is cretinism, their nervous system is not properly developed. So if thyroid hormone increase in body, they cause hyperthyroidism, increased metabolism. One of the situation is grave disease. What happens in it? Increased heartbeat, increased sweating, body temperature is increased, shivering of hand, increased energy production. And such persons, they are very thin and slim, underweight. And hypothyroidism, such persons are obese, drowsy, suffer from bradycardia, low heart rate, all that, and not sweating, body extremities, they are cold, skin is dry, and they feel all the time drowsy, non-active. And calcitonin, it controls calcium metabolism in body, and it's directly or indirectly its secretion is controlled by calcium, blood calcium level, not by TSH. And ultimately, what does it do? Whenever secretion of calcium in blood is increased, they try to this hormone tries to deposit it in bones and making the bone stronger and decreasing blood calcium level in this way. I hope you must have enjoyed today's lecture. If you have any queries about the teacher or the subject, you can always email us, contact us at ourchoiceouc@gmail.com. Okay, take care. Allah Hafiz.